and enriching experience. To chair this brainstorming session, we'll have with us Dr. Shailendra Sir and Dr. Jadhav Ma'am. I request respected Dr. Shailendra Sir and Dr. Jadhav Ma'am to occupy their seats on the dais. I request Dr. Arpita Ma'am to welcome our esteemed chairperson with a rose as warm floral welcome. Today, we have the privilege of being in the presence of a true visionary and leader in the field of Ayurvedic OBGY. Our guest speaker has dedicated his career to uplift basic principles of Ayurveda in the field of Stri Rog and Prasuti Tantra. Dr. Hanmantrao Palep, a founder of Dr. Palep Medical Research Foundation, which is situated in Telangana in the year 1938. He graduated in Ayurvedic medicine and surgery from the renowned R.A. Poddar Medical College in 1962. Thereafter, he completed MBBS and MD in modern obstetrics and gynecology from the prestigious Grand Medical College, Mumbai in 1973. He is the only recognized teacher in the Mumbai University who has graduated in both modern medicine and Ayurvedic faculties. He is a renowned gynecological surgeon, an eminent obstetrician, and infertility specialist. Currently, he is the national professor and visiting scientist of Hafkine's Institute of Research and Testing, Parel, Mumbai. Dr. Palep has spent a major part of his prolific years in imparting knowledge both in India and abroad. No wonder Ayush Department of Government of India selected him and deputed to conduct short training courses in Ayurveda for the medical students at the prestigious US medical school like Boston, Harvard, and Johns Hopkins in summer of 2007. His relentless research efforts led to finding novel Ayurvedic solutions on modern scientific parameters to various alignments of stubborn nature. So, friends, without further ado, let's begin our journey into the intriguing world of management of adenomyosis and endometriosis. I am honored to invite Dr. Palib Sir as speaker of this session and share his valuable insights.
So you will change the slides from your end. Hello.
Yes, sir. Okay.
So when I say next, you will change the slide, right?
Okay, no problem. Yes, sir.
All right. Thank you very much for inviting me to your wonderful program. I very much wanted to be with you all, but unfortunately, because of some medical issues, I was not able to travel to Pune. And I congratulate you to carry on the legacy set up by of my own teachers, Dr. Avasti, Dr. Kinzavdekar, and Dr. Nagral. These are all were my teachers. And I'm very proud that you are continuing their legacy to this, and you're doing an excellent job of promoting integrative medicine. Now, before I start on the subject of Udavarta Yoni or endometriosis, I would like to say a few things that integrative medicine, as we understand, is something like a mixture of modern medicine and Ayurveda. But as a professor of modern medicine as well as Ayurveda, both in years long, almost more than 30 years of my teaching, I did not find much difference between the two. They're, they're seamlessly integrated. The only problem is many people don't understand this. I can give you an example. While I was teaching at Grad Medical College, it was very easy for me to describe the union of an egg with the sperm caused embryo, but whereas in Ayurveda that was not true. Shukrartava Sanyoga was not the only way that the Garbha happened, but that required an Atma to be present in that. Now, this used to pose a problem as to how do I explain this Atma into the whole thing. It is very important for all of you integrated graduates to understand that these concepts of Ayurveda are far more far reaching than modern medicine, which is very, very simplistic to understand. And where Ayurveda needs a lot of thinking. You know very well, after the conception, when the embryo, during embryo formation, the half chromosomes of the father, half chromosomes of mother come together and mix match, then you get your own genome, which is quite independent of your father and mother, with some changes of your own. And that gene imprinting happens in first 6 days of the conception. If that first 6 days of conception, the gene imprinting does not occur properly, so the pregnancy does not progress. That's how every time an embryo, when an egg is fertilized, the pregnancy does not occur. And they requires this gene imprinting. That is, genes are nothing but the memories from generation to generations. They come as a chemical impressions in DNA, and that's how it is transmitted from generation to generation. So that's how you must understand Atma concept is all about information, knowledge, and information and knowledge is the most important point of a living individual. You should know that every single cell is as important organs as whole of your body. Do you know that what is the brain of the cell, single cell? The single cell's brain is its cell membrane. So many people don't know that the nucleus is not everything. Nucleus is only a reproductive organ of the cell, nothing more than that. So therefore, you must understand that Pinda Brahmana Nyaya concept of Ayurveda has a far-reaching consequences, and that we must understand in the terms in Ayurveda, how Ayurveda has explained the things so subtly, but many people don't really understand that. So that's why when we talk of integration, it needs to integration of the whole sciences, whole literature in a systematic way, so that they don't look different. They are part of each other. And that's sort of integration, what I think is the need of the day for integrative graduates who understand it's not that just simply modern technology is what we take over and don't understand Ayurveda in a true terms. So that's how I just want to give this small introduction to integration. And then let us proceed to today's subject, that Udavarta Yoni is described in Ayurveda, which fits into the whole concept of endometriosis. Vegad avartana jyonam udavartaye anilaha. So that means the whole concept is that obstruction of the vayu, anila, sa rugartaha rajaha kruchena udavartanam vimunchati. So once the menstruation starts, the period, the pain gets over. That's how it has been shown in Ayurveda, this concept of Raja traveling upwards because of the peristaltic movements of the uterus and passing into the endometrial cavity. And this is how the whole concept of Udavarta is generated. But I will like to tell you that this Udavarta is not limited to only uterus. Remember that. Udavarta is also extend right up to your whole posture, and this needs to understand in a different way the concept of your endometriosis. We'll come to that little later. Next slide, please. Next slide. Next slide, please. So when natural urges, no, go back, please. Go back. Go back. Natural urges are withheld. Natural urges are withheld intentionally, otherwise. Vayu travels in reverse path, leading to retrograde menstruation, dysmenorrhea, menstrual flow established, pain and discomfort gets released. This description compares to spasmodic dysmenorrhea as well as endometrial dysmenorrhea. So what do they cause? Disturbed apana, reverse peristalsis in uterine smooth muscle or retrograde menstruation that we should understand in terms of the cause of endometriosis is well defined in IVF. Next slide. Endometriosis is defined as the presence of ectopic endometrial tissue outside the uterine cavity that responds to cyclic or hormonal stimulation. It invades surrounding tissues. It is only a benign condition which invades other tissues. This is to be understood very clearly. The ovaries, fallopian tubes, peritoneal surfaces, cesarean scars, uterine myometrium, bowel, bladder, pleura, even distant places, nose, there are various sites that there can be invasion of endometriosis. Next slide, please. Endometriosis, when it happens in the myometrium, endometrial glands get into the myometrium. So the uterus becomes enlarged and it's a globular in shape. And this leads to menorrhagia, dysmenorrhea. This condition is called adenomyosis. So endometriosis, extension of the endometrium, functional endometrium into the uterine wall leads to adenomyosis. Next slide, please. Next slide. Triggers a chronic inflammatory reaction resulting into adhesions, pains, adhesions, when scar tissue attaches, separate structures, organs together, distort entire anatomy. The functional hormonal levels affect the activity levels, thus complaints vary during woman's menstrual cycle. So you don't get a same picture in every patient. Next slide, please. Yeah. A typical way that endometriosis presents, a mother-in-law explains the condition very well. So normally the mother-in-law tells this woman is all the time complaining of only pain, does no work at home, nor is she doing anything which is uh, important in the home, and also she doesn't even conceive. So such a severe, and in endometriosis, the woman is having pain during the periods, before the periods, and even after the periods. There's hardly any time that this woman is pain-free. So she's most unproductive woman ever you see in the society. So triggers this, next slide, please. Next slide. So what is this incidence? 2 to 10% of the women in general population and 30 to 50% in infertility. You can see how big is the problem. This sometimes they experience very severe symptoms, premenstrual, intramenstrual, postmenstrual, and quality of life significantly reduced, increased restraint of normal activities, pain, discomfort, infertility, anxiety, depression. All things put together is the picture of endometriosis. Next slide, please. Next slide. While some experience severe pelvic pain most of the days for the menstrual cycle, many have no symptoms at all or regard their symptoms as simply being ordinary menstrual pain. In rare instances, cyclical pain can also involve upper part of the abdomen, scars, under the ribs or the chest or any other place. Next slide. So just to sum up the various symptoms which I already described, I need not go into again these things. Next slide. Next slide. So how do we explain this retrograde menstruation? See, normally some amount of the endometrium always in normal patients also gets into the peritoneal cavity. But this does not cause implantation of endometrial tissue in the pelvis. In all the women, otherwise every woman should have gone this. Why does it happen? The immune cells in the peritoneum, they should destroy these implants immediately. Ordinarily, they will destroy. But how do these ectopic cells survive and create inflammatory response? That's a question, and we need to answer, and leading to chronic pelvic inflammatory state. So how does that happen? So you know that the peritoneal fluid in cases of endometriosis is different from the other patients. It is rich in inflammatory cytokines, COX2, interleukin 6, VGF, UPA, urokinase. These are endometrial cells normally which are present, which will devour this any foreign body. But that does not happen for whatever the reason. Next slide. Now you must understand VEGF is angiogenesis occurring throughout the fetal growth and development. In adults, it is limited to endometrium during the menstrual cycle. In this, ovary during corpus luteum inflammation. In the pathological states, for example, wound healing, diabetic retinopathy, tumor growth, and endometriosis, VEGF is present, and tissue factor is abundantly expressed on endometriotic endothelium. So you can understand in the blood vessels, the endometriotic endothelium in the blood vessels, there is a tissue factor which is abnormally expressed. Next slide. Next slide. Now there is a new concept has come, which is very much in the way that Ayurveda thinks. Now, what is the concept? The concept of this is this whole pathology is a Koshta pathology or a Grahani-like symptoms you can see in most majority of the patients of the endometriosis where there is a deeply invading endometriosis. So you can see this. What is the reason? Because there is a lot of now interest to enteric gut microbiome. The enteric gut microbiome, the bacteria which are present in the large gut, they are completely altered in case of endometriosis. They found that endometriosis patients have a different type of gut microbiota in compared to normal women. Now, certain gut microbiota weaken the intestinal barrier and cause leakage of activated neutrophils into peritoneum, leading to inflammatory state. Now, we ask the question, why is that inflammation? The answer is here that certain microbiota, which are abnormal, they break the intestinal barrier and that causes leakage of activated neutrophils into peritoneum. And that results into the inflammatory state of the whole peritoneal cavity, where this is not able to prevent the extruded endometrium in the due to reverse peristalsis into the peritoneal cavity. Now today, we can test these patients very simple mechanism. Salivary microbiota represent even gut microbiota. So a salivary swab can tell us what is wrong with your gut. So you need not have to take swabs from the colon, swabs from the and there. But you can just take a salivary microbiota test, and that should be good enough. So what is the difference in this? There's increased abundance of formicutes and decreased bacteroides and Rhinococcus phyla in gut microbiome. This is a characteristic of endometriosis. And E. coli are another important bacteria which are believed to be the primary source of lipopolysaccharides. Next slide, please. So therefore, now we understood the whole thing that endometriosis is more a poster vyadhi and in which Vata Prakopa has happened. And that's how Ayurvedic concept fits very well. Now there is something Ayurveda talked very, very important. All the diseases owe their genesis to Prajnaparad and Sroturoj. What do you mean by Prajnaparad? As I said earlier, that every cell in your body is intelligent. A blood cell is different from a heart cell, and from a heart cell, a liver cell. They are all different, and they are differently intelligent to do their own work, own functions. Now, failure of the cell intelligence and obstruction in the transport channels of the body, the receptors, ion channels, when you consider the same thing, translate into modern concepts, it is very, very relevant that Prajnaparad and Srutorod are the basic fundamental causes of all the diseases. So non-physical, sentient, informational, intelligent knowledge systems, which we call as Purusha, direct the Panchamahabhutik molecular elements and mechanisms. So this, if you once you understood Prakriti Purusha Sayog and Prakriti Purusha activities, you realize that a sentient informational system to non-sentient physical systems, when these are combined and they work in coordination. And this is directed by three principles, Vata, Pitta and Kapha, and all that control biological process in the body. Vata representing as a signaling pathway of regulatory mechanism, whereas Pitta is a signaling pathway to transcriptional, transformational, enzymatic systems in the body. And Kapha is nothing but the signaling pathways for structural, stromal, cellular, vascular mechanisms. So if you understood this fundamental in the modern terms, I think Ayurveda becomes more modern than the modern. Next slide, please. Next slide. Even when you try to see Shat Kriya Kal, for every pathology, we talk of Shat Kriya Kal. Sanchaya, Prakopa, Prasara, Sthana, Samshaya, Vyakti and Veda. You all know it very well. Next slide. Next slide. How do you explain this? If you see this slide, which I have created for you, you understand today's modern inflammation is understood in this particular way. When there is an injury, then there is sensing, and when there is sensing happens, the next thing is the molecular mimicry, molecular mechanisms come into force, and the next thing, so what happens in 5-6 phases, which I have shown here on the slide, how the inflammation process happens. And this in stages goes to end in homeostasis, the complete healing. And these stages, when you see in a regular way, the body heals itself. But for any reason, this cycle is obstructed. This cycle does not completely go. Now, as for example, today, we are so fond of using anti-inflammatory drugs so early in the inflammation to relieve pain, to relieve so many problems. You use anti-inflammatory drugs. What happened? The slide has disappeared. Hello? Hello? Hello?
Hello.
Ah. So There are two pathways. If it is obstructed, either it will go into degenerative condition, senescence, or it will go into genomic instability. Then mutations happen, genetic, and cancer on one side and degeneration on the other side, chronic disease and degeneration. So if you understand this Shat Kriya Kal is exactly the same way that I have described the six uh, stages of inflammation you can see on the slide. I think you will understand that Ayurvedic concepts are very much viable and they need to be properly interpreted. You understand? Next slide. Next slide. Next slide. So let's come back to endometriosis. This was what I wanted to inform our young people that Ayurveda, we talk of Shuddha, mixed, this, that, and all that. It is not so. Ayurveda is a very advanced science, but all that you need is to reinvent in that particular way. Now, classification and staging of endometriosis, American Society of Reproductive Medicine, stage 1 and 2 are minimal, mild disease, superficial peritoneal endometriosis, possible presence of small or deep lesions, no endometrioma, mildly filmy adhesions if present. Stage 3 is the peritoneal, is not just superficial but deeply invasive endometriosis. And where the organs are involved, uterus, bowel, endometrial cysts, and various issues can be created, and this is an advanced stage of the disease. But what is very interesting is many advanced stage disease do not always indicate of symptoms, nor necessarily optimal treatment to manage these symptoms are possible. So many times there is also, even after we do whatever the treatment we have done, but there is again recurrence is very common in these patients. Next slide, please. Next slide. Superficial peritoneal endometriosis, cystic ovary endometriosis, deep endometriosis, also referred as deep infiltrating endometriosis. The different types of disease may occur. They impair the fertility because of distortion of anatomy, ovarian disease, adhesions. So therefore, infertility becomes a major issue in cases of endometriosis, and stage of the disease may have different disease presentations and types. So therefore, just by stage, we cannot assume anything. Some forms of severe disease are not included, invasive disease of bladder, bowel, and even diaphragm. So it's a very, very difficult conditions we get out of endometriosis. Next slide. Superficial peritoneal endometriosis, lesions involve peritoneum, which is on the thin films that cloaks inner surface of the pelvic cavity. Lesions are flat, shallow, do not invade into space underlying peritoneum. That's superficial. Cystic ovarian endometriosis, endometriomas, is a cyst which is wall of cysts that contains areas of endometriosis. It's filled with old blood. Because of the color, the cysts are referred to as chocolate cysts. Deep endometriosis, and endometriosis lesion is defined as deep if it is invaded at least 5 millimeters beyond the surface of the peritoneum. Given the peritoneum is very thin, deep lesions always involve tissues underlying the peritoneum and retroperitoneal space and pelvic organs. Next slide, please. Clinical signs of diagnosis of endometriosis. Per speculum examinations, you might find bluish vaginal lesions on the cervix, vagina in some cases. Bimanual vagina, tender nodules in vaginal fornices, especially in the deepest point of the vagina, in the pouch of Douglas. Deep endometriosis or endometriosis of the ovaries. Clinical examination may give considerable information regarding a proper diagnosis. And peritoneal disease, clinical examination most of the time is completely normal. You may not even suspect. And therefore, you have to use other methods to diagnose, ultrasound and MRI. Even the MRI and ultrasound must be done with very great accuracy to special techniques are used, especially with MRI, to understand the depth of disease. Next slide, please. Next slide. So laparoscopy is used for definitive diagnosis, and other measurement biomarkers such as CA125. These are all not really very useful and not very much recommended. And extraperitoneal endometriosis, cyclical short pain, etc. we already described. And we may require to use X-ray, chest, CT, MRI, etc. So therefore, other methods for diagnosis are used in this case. Next slide, please. Now, what treatment options we have? To go to a modern doctor, all that a doctor can give is analgesics and hormones causing pseudo-pregnancy, progesterone, including hormones loaded with intrauterine devices, Mirena, GnRH, antagonists, agonists, aromatase inhibitors, letrozole. And of course, surgery for the correction of the anatomical distortion is very important. It's generally effective for relieving pain symptoms, but it may not always improve all symptoms. Remember that. So we do a lot of laparoscopy or surgery for these cases, but there can be only temporary remission, and there can be, I've seen number of the patients coming back after the surgery with severe symptoms. Next slide, please. Next slide. Hysterectomy, if you have completed your family, other treatments have not worked, you may consider removal of the uterus with or without removal of the ovaries, surgical menopause or menopausal symptoms or finishes, the ovaries are removed at the same time. Now, ovarian removal is better if you don't require any more fertility or something. It is better. Hysterectomy does not always solve the problems. If endometriosis is inadvertently left behind after the surgery, hence pain symptoms may recur, remain. So therefore, though treatment is giving relief, but not always. Hysterectomy, definitive in case of adenomyosis. In the case of adenomyosis, there is no better treatment than the hysterectomy. Next slide, please. Aromatase inhibitors, letrozole, which is supposed to reduce estrogen, is considered. So therefore, people have tried letrozole 2.5 milligrams, progesterone 2.5 milligrams, calcium citrate, vitamin D, and daily for 6 months, and a second look laparoscopy to confirm the results. Next. And they found that some moderate to severe disease pregnancy, so this treatment did help in some patients. And aggressive medical treatment to suppress called pseudo-pregnancy, they are done. When pregnancy is desired, what do you do? So anatomical damage may not be unable to correction. ART, IVF, and embryo transfer is the other thing which we should consider in cases of those who are suffering from endometriosis. Next. Vidavarta Yoni Chikitsa, now coming back to Ayurveda. Do we really have something to help these patients? Apanama Dvayu Dushti, Vata Shamana Chikitsa, Snehan Swedan Basti are the mainstay of the therapy. I urge most of our friends who are practicing Ayurvedic therapy for endometriosis, please try these methods of Yapana Basti or some Dashamula Basti or something for Vata Shamana. And that would be very useful in Dashamula Path, fermentation locally. And this would be very ideal for this Udavarta Yoni patients. And for the Agni Deepan, you must understand, Pipalyadi Gruta, Prasadna wine, and Shunti. Shunti, people have worked on ginger ale to show that there is a good amount of pain relief in these patients. And ginger ale or Shunti is in Pipalyadi Gruta is already there. So Ayurveda concept works here. But my advice to most of our friends would be never perform Uttar Basti in these patients. For God's sake, because I have seen 2 cases of Uttar Basti which ended in pyosalpings in 2 patients and with disastrous consequences. So therefore, my request to people not to use the Uttar Basti inside the uterine cavity to help these conditions. Next slide, please. Next slide. Then ahara, milk, sesame seeds, wetland animal meat juices are what is ahara. Krutapana, Baladi and Kashmariyani for Pitta Shamana, Agnidipana and Pachadam. And altering the gut microbiome. We have an Ayurvedic concept of, we have already said, poster how to treat, and that is possible now with fresh Panchagavya Prashan. Panchagavya, you must understand, has all the microbiota from the cow, right from the dung, urine, milk, curd, and ghee. And this is used to give probably good results. We are now coming out, our researchers show that it is very useful, Panchagavya, fresh Panchagavya, and we are trying to make fresh Panchagavya into a capsule. In time to come, we will be able to present you with that. Maybe that will help altering the gut microbiome to make the things better. And Kalka and Tailapichu of Saindhava, Tagara, Kushta, Brati, Devadaru, etc. This could be used vaginally, but not intrauterine douches as some people are using. Urine of goat urine is used in the Kalka preparations. And again, just as I have described earlier, Panchagavya, goat urine also was recommended in Ayurveda. Next slide, please. Haridra is shown to be useful experimentally in animals. Chinese herbal preparations consist of 11 herbs that include ginger, cinnamon, which have caused reduction in endometriosis, reduction in E2 levels. So there are papers available on this Chinese medicine, Chinese herbal preparation, 11 herbs, and that is in line with our concept of Deepan Pachan, Vata Pitta, Shamana drugs of Ayurveda. Now, we have used in a doctor patient who had undergone surgery for endometriosis and infertility and had residual lot of pain in the abdominal, abdominal pain. And this patient we treated with Enteropan, one of the drugs created by Dr. Palep Medical Research Foundation, and specific to GI to alter microbiome and bowel peristalsis. And along with pentaphyte, which is got a quorum sense inhibition property. Now, I must tell you what is quorum sense inhibition. Up till now, we only knew that there are drugs which are antibacterial, either bactericidal or bacteriostatic. But here, we are presenting another concept which is called quorum sense. It is the inherent capacity of a bacteria to make the host friendly to it, so that it has to form it can enable it to form its own colonies. Now, in order to that, there is called quorum sense, its property. And pentaphyte P5 is a Panchavalkala, which we have created. And this has shown action at the level of the colon cells so that the bacteria are not allowed to make host friendly. So therefore, they can form colonies easily and ultimately they die without proliferation. So it is the third mechanism which you must learn. In Ayurveda has provided this benefit. And torsional is another drug which is a powerful immunomodulator which enhances the endometrial embedding and all that. This has given relief. This combination of the three drugs gave relief to these patients who suffered from post-surgical pain of the endometriosis. Next slide, please. So, Gynocare is another polyherbal preparation which we have created for the hormonal imbalance. And the concept of this Gynocare is based on Ashoka and Lodra combination. It's a fantastic combination of Lodra, which controls the pituitary hormones, along with the Ashoka, which controls the uterine environment and uterine muscle action. So both this combination, what Ayurveda has created, which is the main principle of Gynocare, is a very, very important medicine which we are promoting, and that would be useful for many of you in polycystic ovary and other conditions. Next slide, please. Now, we have experimentally shown that ovarian weight and volume and adrenal weight and volume was reduced by Gynocare treatment in the animals without architectural change or morphological architecture of the ovaries in number of the animals experiments we show. And it's absolutely non-toxic and it's targeting the ovarian and adrenal glands. So it speaks volumes when we talk of the Ashoka and Lodra combination. And is pituitary ovarian axis is Lodra and Ashoka touches the uterus. So this is a wonderful mechanism. And Yashtimadu is a mildly estrogenic in action. So all these put together, it is a remarkable drug that can be used in your day-to-day whenever there is a hormonal imbalance is there. Next slide, please. Next slide. Thank you very much. I tried to do the best of what I can do to give you the information on Ayurveda as well as the modern medicine. Thank you all. You are welcome to ask some questions if you have any.
I thank Dr. Palep sir for such a wonderful session. Now I would like to request our chairperson, Dr. Shailendra Sor and Dr. Jadhav Ma'am, to give their valuable chairperson remarks.
Good morning. Can we take some questions from the audience?
If anybody has any question regarding this session, they can kindly ask. Yes, ma'am, comment.
What should be the treatment of endometriosis when patient come in our OPD as per you?
Your OPD,
Palep sir, can you?
in the OPD, when you get a patient, you must first of all diagnose exactly what is the status of this particular patient. Now, what patient, because every patient has a different type of the symptoms. As I say, even severe endometriosis may be without symptoms. Now, what exactly you want to make a treatment, you should clarify. So then we can, I've given you different levels of the treatment, right from severe patients where, panchakarma treatment could be given, shodhan treatment to start with, and we can give the medicines which I have been using in my practice, like Enteropan and pentaphyte and torsional. This combination I have been using in many of my patients with symptomatic endometriosis. And if there is a menstrual issues, excessive bleeding, etc., then I would irregular bleeding, then I would use gynocare.
Can you please repeat the medicines, sir? Medicine part once.
For the patients who have abdominal symptoms, pain, you have to give these patients the primary treatment of Vata Shamana. That's very important. I think a yoga basti and all would be very ideal, but in OPD, for the general practice people who don't have this facility of Panchakarma, I suggest the use of these three drugs of mine, enteropan, the torsional, and pentaphyte.
Thank you, sir.
Anybody else who would like to ask question?
Good morning, sir. Hello. Good morning, sir.
Go ahead.
Sir, I have a
Go
question.
ahead.
In many times in the reports we see in the USG reports, we come across the finding of bulky uterus. Is it always related to adenomyosis, and how should be the approach to it? Bulky uterus.
Endometriosis in adenomyosis is different from other uterine swellings like myomas, fibroids. So it can be clearly seen. It has no any margin where it can be resected out, like in fibroid there is a capsule, so that could be removed. But in this case of endometriosis, there is nothing like that. So you have to give only symptomatic treatment in most of the cases when you are treating this adenomyosis with symptoms. What symptoms it has got? Whether it is a profuse bleeding with a globular uterus, very huge uterus, if the fertility issue is not there, ideally I would recommend a hysterectomy.
Okay, sir. Thank you.
Anybody else? Mike.
Good morning, sir. My question is, there are two conditions, like sometime patient is infertile, she is willing for the conception, and sometime patient is required just a symptom relief. She's having children and she wants just a pain relief. Then how the line of treatment differs in both the conditions, and what treatment we should avoid the patient who is willing for the conception?
Why I have already said the treatment which you should avoid is Uttarabasti in patients who want to conceive. That's very, very important. And especially invading into uterine canal is dangerous because the fallopian tube epithelium is very, very sensitive ciliary epithelium. And once the cilia are destroyed because of the oil, what you lose that functional capacity of the tubes. So my only objection to use of this to those energetic, enthusiastic gynecologists, the Ayurvedic gynecologists, to use Uttarbasti may be avoided. That's number one. If the patient who is not desirous of any further, to remove this, release the symptoms, the surgery should be planned, and what type of the surgery will depend upon the extent of the disease. So you cannot arbitrarily decide the treatment. And of course, temporary relief of pain due to antispasmodics, anti-pain relief drugs is welcome, but they cause their own side effects. I would like to avoid them as far as possible. Okay? Does that satisfy you?
Thank you so much, sir. Now would like to request our chairperson of the session to give their valuable remarks.
Hello, good morning to all. Good morning, Palep sir. I am Dr. Katak Dond. session was very wonderful. The way you expressed modern as well as Ayurvedic part, because you are an integrated person. You have done BMS also and MBBS also. So you are the right person to tell both modalities precisely. Thank you, sir. The point
Thank
is that
you.
I have only one query regarding the medicine, that it contains Ashoka and Eshtimadu. Both are estrogenic drug. And as per my knowledge, endometrium is related or increased with the estrogen. Estrogen gives life to the endometrium. Then how can they act to minimize or to work on the endometriosis? This is my question. One thing, Ashoka is estrogenic drug, and estrogen gives life to endometrium. Then how can it act?
Well, Ashoka is not only used for the purpose of what you said, estrogenic. More importantly, Ashoka has got a powerful action on the uterus. It is a uterotonic. It is not estrogenic, but it is most importantly is a uterotonic. That means it aids the contractile power of the uterus. Now here, the proper uterine contractions we can create in the uterus is the concept of using, my concept of using in gynocare, this particular product. And whereas when I use Lodra, the Lodra is supposed to be controlling the hypothalamo pituitary axis. So that is how, and then when you say Yashtimadu is a mildly estrogenic, it's not as estrogenic as what normal estrogens are powerful. So it is very mildly estrogenic. And that's how, there is a balance between more estrogen and less estrogen. So you must understand, there is a power play in your body. When the estrogen is high, what happens? When the estrogen is low, and when it is normal, what happens? So you need normal levels of the estrogen. It's not the absence of estrogen, it's not the absence of or increase of estrogen. So you must understand that. So it is the modulation what is very, very important. And what I have seen in the number of the cases of the polycystic ovary, this drug has reduced the ovarian volumes to regulate the cycles. So this has been my experience with this particular drug.
Okay, thank you, sir.
Then
Thank you, sir. So I have no inputs from my side. The lecture is very wonderful. I would like to thank all the organizers who has given me permission to be chair here. Thank you, madam. And taking this opportunity, I would like to thank our secretary, Dr. Priyanka. She is indeed, she is an iron lady, sir. The Sushrutee 2023 and 2024 is successful because of her. There are again, please, I'm requesting everyone, please give a big applause. I would like to thank Ghorpade madam for organizing such a wonderful CME. Initially, it was on the CME was planned on Bharti, but later on, it is shifted to Hadap sir. In very short time, they have organized everything. I have been here for last 3 days. The students, the participants, they are enjoying. On the first day, they are enjoying workshops on IUI, on laparoscopy, and on Sthanik Chikitsa. Really, it is very knowledgeable. On the second day, we have live demonstration of surgery. I think you all are enjoyed that also. And now we have beautiful lectures. Thank you everyone. Thank you Sujit for thank you Sujit for organizing such a nice live workshop. Please give a big applause to Dr. Sujit Shinde also. Where is Ajay? Where is Ajay? He's also pillar. Archana relentlessly working. Please give big applause to Archana also. I think she is not sleeping since last 3 to 4 days. Where is Archana? Archana, please come. I am requesting, please, please, these are the pillars. Please come. Please give a big applause. Thank you. Thank you.
Hello. Hello. Myself, Dr. Anjali Jadhav from Ayurved Mahavidyalaya, Akurdi. I am thankful to Dr. Palep sir. We already visited Palep Institute 10 or 12, 15 years before. Dr. Ghorpade was also there. Salute to the sir's consistent work. And now my input for this session is that is take home message. The practitioners must treat endometriosis or Udavrata Yoni Vapor in their small setup also with Panchakarma facility. Just focus on Nahi Vatadrute Yoni Narinam Sampradoshiti. So Vata Shaman in all forms, that in Snehan Swedan and Basti also. And as Apan Vayu is the main, Apan Vayu's role is main in this. So Apan Vayu's is Srushta Vidmutra Artava Garbha. So we are giving right direction with this Basti. And last but not the least, counseling about lifestyle, that is Ahar and Nidra. That's all. Thanks a lot. Thank you to organizer for giving me this honor.
Thank you so much, ma'am. Now, I would like to request Dr. Ghorpade, ma'am, to felicitate the chairperson with memento and certificate as a token of love. Now, I would request Dr. Ghorpade, ma'am, to felicitate Dr. Shailendra, sir. Because of health issue, Dr. Palep sir couldn't come, but Palep sir, we thank you for such an informative session. It was a wonderful and informative session. I would like to thank all of you present here for your enthusiastic response and patient listening. Now I conclude session 1. Once again, thank you, Palep sir,